diabetic medications, but he's not compliant. He's uncontrolled, and we gave him metformin. He's diabetic for 10 years. His fasting blood sugar is 250, but the blood sugars are not controlled. How are you going to explore this? Address this.
I will counsel him why he is not complying with the medication. Strong.
Why is it so?
Yes.
So you want to first explore. Know the cause. Why is it? Is it because he is not compliant with it? Doctor, I don't take medications regularly. Then
Forgetting or
forget something. Missing medications.
Side effect of drug.
Maybe the side effect of the drug.
He doesn't believe in that.
Maybe doesn't he believe in that? Maybe he has something else in mind. So
He cannot
exploring
buy.
things. Huh?
You cannot buy the
Cannot buy, so don't have enough money to buy that. Some of the sitagliptins that we give, this is DPP4 inhibitors, they are very expensive, by the way. So that can be one factor. So social factor is also important. Not feasible, doesn't like the drug, have severe side effects, doesn't believe on that, believes in some alternative therapies. So you want to explore things. Why do you want? You know that you have to do half an hour walk. You need to comply with the diabetic diet, but he is not compliant, and you need to explore why. Because maybe the patient doesn't think that there's going to, doctor, I just eat a little bit of sweets, no problem for that. This is what his perception. So you want to explore things up, but whenever you find a cause, you should not be offensive to that. Because if you become offensive, okay, you should not eat sugars, you should not eat these bakery items, you should not eat these junk foods. So it's kind of an offensive thing to the patient. You cannot do this, you cannot do this, you cannot do this. What should I do? It's a whole lifestyle thing, and it's not just for 1 week, for 2 weeks, for 3 months. It's the whole life. So you want to make sure that whatever counseling tips, whatever counseling thing that you're doing, don't be aggressive to it. And don't be overjudged. Don't overjudge the patient. Don't overimpose things on him, because it's going to, first you need to build up a rapport. While you need to build up a rapport, before that you need to explore things up. You need to understand his problems. You need to understand his criteria and symptoms. Why is he not compliant with the medications? So what is his idea? So the counseling is ICE. I is ideas. What is his idea? Probably he thinks that the diabetes is just 2 months thing and then it goes away. So you want to explore ideas. What is his idea about it? Maybe it's a diabetes or any chronic problem, or even any smoking problem. If the patient comes to you for a smoking thing, you also need to perceive his idea. Some smokers says that I do smoking because it relieves my constipation. Some says that I do smoking because of the stress. So their idea is to relieve something, and they have a rationale behind that. So you first need to explore these ideas. Then comes the concerns or expectations. This is ICE. Concern is maybe the patient is concerned about maybe his money, to save his money. If he's a smoker, probably he's concerned about his job or his stress level that he cannot cope up with, and then you need to provide some alternatives to that. Concerns, all right. First is idea, his perception. Second is concern, whatever he's concerned about it. Third thing is expectation. You should explore that why is he not. What is his expectation out of it? Does he expect to be cured? Does he have something else in his mind to get these things up? Is he expecting a lot more, or is he expecting a lot less from himself? So you need to also explore that. Once you did ideas, concerns and expectations, then you can lay down your counseling thing, your management plan based on that. I'm just giving you the principle of counseling. Whatever is the case, whether is it a diabetic chronic problem, whether is it a breaking bad news thing that some malignancy comes up, or is it a smoking addiction kind of a thing and it comes up. So you need to explore some relevant points. So and then you need a layered management plan. For instance, the patient we just discussed the diabetic scenarios or any chronic problems that are there. Then we need to see whether the patient is a smoker. Then you need to what are the history taking points you will take in this, as we discussed in the presentations previously also. What are the things that you would like to start off with?
For how long are you smoking?
Yeah.
For how long are you
For
smoking?
how long are you smoking? How many packets per day? For how long? Okay.
What makes you smoke?
When did it started? How did it started?
Do you have anything
Why
to
you started?
Why did you start it? Because of the peer pressure or because of any stress thing going on?
Do you have anything to quit?
Do you have any does any intentions to quit?
Do you know the risk and
Yeah.
of the smoking?
Are you aware of the risk factors that are there attached to the smoking? Yes, very good. All right.
You want to quit?
Do you want to quit or not? Did you have if the patient says yes, then did you ever quit before or not?
Do you have stressful lifestyle?
You have a stressful lifestyle, so that
Stressful
these
job.
are all history taking points that you will gather in order to make a management plan. Okay, the patient has stress, then you probably would like to add some counseling tips of the stress also. If there is any, how is it impacting his social life? Probably he's not he does not consider himself in that social gathering where they are all smokers and he's the only one, he's not smoking. So even that can also affect the students or the patients. If he quitted, when did he quit? When was the last time he quitted? How did it started again? So these are all factors that you would like to. When I quit smoking, I started to having some ulcers, or I started having some sleep problems, or things like that. I started to gain weight. Things that anything that comes into my mind, I could not stop because of my friends. They are still smoking. So previous history. Okay. Are you aware of the different addiction cycles or phases of the patients who are a smoker?
Yes. Initial use,
Initial use?
then abuse,
No, I'm not talking about that.
pre-contemplation,
Pre-contemplation phase.
pre-contemplation.
One is the pre-contemplation phase. In pre-contemplation phase, the patient
Don't have anything.
No attempt to
Not
quit.
into
no tend to quit, does not want to quit. If the patient is on this stage, you ask him the history, do you want to quit? If he says no, then there is no point in going up further. You can give him some leaflets, some awareness, and then patient should go away. Maybe some point in time he changes himself to contemplation phase. And the patient says, when you ask the second time or the third time or somewhere in that, you ask him, do you want to quit? And he says yes. Then this becomes a
Contemplation.
Pre-contemplation phase doesn't want to quit. Contemplation phase
Want to quit.
does want to quit. Okay, then action. If the patient is in the pre-contemplation phase, he makes some plans. All right. Probably he makes some plans, or you make plans for him. Whatever is relevant. After that, maybe the maintenance, where you give an action plan. If you want to give the smoker an action plan, what action plan you are going to give? You can give. How he should start. What are the options that are there for the smoking cessation?
But
replacement therapy, nicotine replacement therapy.
Nicotine replacement therapy,
bupropion,
bupropions,
then
Gums, patch.
then self-education.
self-education. Yeah, this is for the non-pharmacological. In the pharmacological, we have
Pharmacy.
yes, there are three categories of drugs. Okay, for the nicotine gums, these are very simple. You ask the patient to you need to ask first if the patient is not willing to quit, you don't offer these treatments. If the patient is willing to quit, only then you're going to offer these treatments. Number one. Second thing is you start off with the nicotine gums usually. You ask the patient to set a quit date. At the quit date, for instance, and that quit date could be set whether is it a good milestone, whether is it a birthday or or an Eid day or a Ramadan or an anniversary, whatever is loved from him or a memorable thing, he should start from there. So you ask the student, you ask the patient, when do you want to quit? If he quits that, okay doctor, from 2 months now, at this date I would like to quit. So before that quit date, you ask the patients to decrease the cigarettes at the quit date, and you plan to start nicotine gums. So at the quit date, after the quit date, you don't want to give the patient not even a single smoke. If the patient is on 20 cigarettes per day, he can decrease it little by little, but at that quit date, if he was smoking 5 cigarettes or 6 cigarettes per day, you cannot allow the patient to even take one puff. At the quit date, he's not allowed to do anything. After that, whenever he has a craving, you should give him nicotine gums. If you're giving nicotine gums, you ask him to part and chew method. You give the patient a nicotine gum. You ask him to, it's a 2 milligram gum. You ask him to part and chew. Whenever there is a thirst, he can take that chewing gum out, and then he chew until his urge is satisfied, and then he parks in the buckle. And whenever he has the intention, he can use it another time, and then he parks it here. Every chewing gums should be used 2 hours, not more than that, and then he has to replace it, because after 2 hours or 3 hours, all the nicotine is gone. So you can give him nicotine gums, no smoking after that, park and chew method, and then you replace the nicotine gums. And then you follow him up after 6 weeks or 1 week or 2 weeks, whatever is there, and then you see. If the patient relapses somewhere, then you would like to start first. Sometimes the patient relapses and it goes into pre-contemplation phase. No, I don't want to quit now because it's useless. And sometimes they relapse and then go into the contemplation phase. Okay, I'll try again. So you need to explain that the relapse is common. So you need to encourage and support the patient that the relapses are common. All you need to do is to stay in touch and keep motivated so that we can work it again. The other drugs options that are available, Chantix, bupropions, in that the same method, quit date, but for that, after that, 1 week before the quit date, you can start. But after the quit date, you don't do smoking, but before 1 week, you can start the bupropions. And so there is a last week where you give bupropion and the patient is also taking some smokings, and after the quit date, he's not going to smoke. And then you need to reassess about the counseling. You need to see whether the patient is receptive or not. If he's not receptive or is offensive, then there's no point. So you need to just stop your consultation wherever is it. And these are some relevant counseling tips. What about the breaking bad news? We have done it a lot of times. Spike protocol is a well explanatory thing, and you need to explore it, warning signs, digest. Even once you give the patient a warning sign, you need to know why. Is he emotionally stable? You give some silences, and then you give some support which is relevant, realistic, and then you give some follow-ups. So breaking bad news, if you want to break it down, first some introductory part where you build up a rapport, make sure that the privacy is there, you give some warning shots. Alright, after that you give an actual news. Okay, I'm afraid that you have this one, this is a bad news. Okay, then you wait for his response, whether is it aggressive, is it in denial, is it depressive, whatever. You give some silence, you explain that procedure to the patient. Okay, this happens like this and this and we did this and we did that. After you've done your explanation without breaking bad news, then it comes out follow-up. This is the third stage. In the follow-up, you will do some follow-ups, you will assess his condition, and then you reassure things, you give him some plans. But if you think that the patient is not digesting anything, then you probably would like to brief up your follow-up, and then you can say, okay, maybe we can discuss, they follow up the other plans maybe in the next visit. So it's same as the spike protocols, but you can also do it in that way. So these are about counseling techniques.